How do vets drain pet wounds? Imagine your pet has a deep cut or a big abscess that's filled with pus or blood. It can be uncomfortable and risky if not treated properly. Veterinarians have a way to help clear out that excess fluid and speed up healing. They use special devices called drains to do this. Drains are thin tubes placed inside or near the wound to let fluid escape. This reduces swelling, eases pain, and cuts down the chance of infection. The decision to use a drain depends on how big the wound is, where it is located, and how much fluid is building up. There are mainly two types of drains. The first is called a passive drain. It works by gravity and the natural pressure inside the body. An example is the Penrose drain, which is a soft latex tube. The vet inserts it into the wound through a small cut. One or both ends stick out of the skin, often covered with a bandage. The fluid flows out onto the bandage, which needs regular changing to keep the area clean. The second type is called an active drain. It uses suction to pull fluid out. The most common is the Jackson-Pratt system. It has a small tube connected to a soft plastic bulb. When the bulb is squeezed and sealed, it creates a vacuum. This vacuum pulls fluid from the wound into the bulb. Active drains are better for deep wounds or when a lot of fluid is expected. For very large or complicated wounds, vets might use negative pressure wound therapy. This is also called vacuum-assisted closure. It involves placing a special foam dressing over the wound and attaching a machine that gently pulls out fluid. This helps the wound heal faster and keeps it clean. Before placing any drain, the vet cleans the wound thoroughly and removes dead or infected tissue. This step is very important for the drain to work well. The drain is then inserted carefully and secured with stitches so it doesn't move. The exit site is covered with a bandage to protect it from dirt and bacteria. Passive drains usually drain onto a bandage, so the vet makes sure the drain's lowest point is at the bottom of the wound. Active drains need to be checked often. The collection bulb must be emptied regularly, and the suction checked to make sure it's working. For vacuum therapy, the vacuum level must be monitored to keep it consistent. After the pet goes home, owners need to keep the wound dry and clean. They should limit activity so the drain stays in place. Watch for signs of infection like redness, swelling, or bad smell. The bandages should be changed as the vet advises. When it's time to remove the drain, the vet will do it carefully. Usually they cut any stitches holding it and gently pull the tube out. The wound is left to heal naturally. Sometimes a light bandage is put on to protect it. If the wound was infected, the vet might take a sample to check if the infection is gone. Drains are helpful tools, but they are not a substitute for good wound care. They can sometimes increase the risk of infection if not managed properly. That's why keeping the area clean and following the vet's instructions is so important. The right drain choice depends on the wound's size and location, and the vet's experience. Proper placement, regular monitoring, and timely removal help your pet recover comfortably and safely.